So again, I'll tell you, we know it's hard. It is really hard. And I've actually heard the analogy that this is like a plane being in the sky, and it's in flight, and it has problems, and we're trying to fix it. Well, I would tell you that if that's true, the plane is crashing, and we need to fix it.
Yes.
Irresponsible in this time that we're in right now. We all know what's happening with the economy. We're pretty intelligent people, I think, and we get it. But it's not irresponsible to work on it now. It's irresponsible to not work on it now. Legislators that are in the room, we ask you to work with us in moving Vermont forward to recognizing healthcare as a human right. Not only recognizing it, but make it a reality. We can do it. We believe. I feel like it's the Santa Claus story. Yes, Virginia, there is a Santa Claus story. But you know what? I believe in Santa. Yeah. So I believe that healthcare will be a reality. I believe that we will someday be standing here celebrating healthcare for all, for every single human being in our great state. Thank you, and we look forward.
How many people in this room can't wait to be 65 years old so they can take care of the single-payer healthcare system in America? How many people here wonder why it is that our friends in Washington, despite the good work of Vermont's congressional delegation, because we have the best congressional delegation in the country, surprised that when the pharmaceutical industry and the insurance industry and the special interests spend $1.5 billion a day making sure that progress doesn't happen, progress doesn't happen. Yeah. Are we surprised? No. We have a job to do. And I think it's incredibly important to acknowledge that we're here at the beginning of the toughest legislative session perhaps in centuries. For the simple reason that our economy is on its knees, that Wall Street has bankrupted Main Street, and that our citizens are left holding the bag. And a big part of their pain is driven by two things. One is jobs. We have a huge number of friends and neighbors who have lost their jobs because of Wall Street greed, and find that in this economy they can't find a new one, and with it they've lost their health care security. We have another group of Vermonters, a much larger group, some of you are in this room, who have a job, but find that in this economy your income is stagnant, your bills are mounting, and you can't afford your health care premiums, so we're all left in a mad scramble to buy less and less insurance coverage for more and more effort. That's the challenge that we face as a state, and that's the challenge that we have a responsibility to fix. And let me tell you this, if Vermont could be, and I believe we can, the first small rural state that partners with our great congressional delegation and our president to deliver a healthcare system that follows the individual instead of the employer, you would see an economic revival in this state that would make the other 49 states wish that they were we. So that's our responsibility. Now, I am a sponsor of S88. I've been a sponsor of bills like this for a long time. But I think what's changing is that most Vermonters understand that this race to the bottom is not only going to cripple our health, it's going to cripple our economy. Right. And by working together to do it the good old-fashioned way, where the special interests don't have the influence that they do in Washington, that together we can make the difference. Now let me tell you about a couple of concrete things that we're planning on doing. As you know, the House and Senate are going to be holding hearings on all of the health care proposals to bring together the best ideas and figure out ways to implement them. Second, I have invited, with the help of Deb Richter and Ellen, and others, a professor from Harvard named Dr. William Schaff to come to Vermont. He designed the Taiwanese system. He gave up on America a long time ago. But when I spoke with him on the phone recently, he said, I actually think Vermont might have hope. So we're going to bring him up, and we hope you'll all come, to invite our committees in to learn about how it can be done effectively and well in all of the countries that compete with us for jobs.
First of all, like Peter, I'd like to say thank you to everybody for being here. And more importantly, actually, what I would like to thank you for are the community forums that you had around the state. Senator Bartlett and Representative Neese and I had a great evening, cold, a great evening in Morrisville, and a healthy back and forth and discussion about the realities that people face, the realities that we, as legislators and as people, have faced in our own lives with regard to healthcare. Because I think it's important for you to understand that while we're not only legislators here in the building, we're actually real people. We have real lives outside of the building. We don't get healthcare coverage as legislators. So we have to figure out how we're going to get healthcare, either through our private employment. For many of my colleagues in the legislature, they actually have to give up their health care coverage while they're in the building or they have to pay for it out of their own pockets because they're no longer full-time employees. So what I would say to you is, we get it. And thank you for helping us and pushing us. What I'd like to also say to you is that we share the same goals. We want to go to the same place. As we all said in Morrisville that evening, it is a travesty that in the richest nation in the world, we do not have health care for all of our citizens. That is and we in the legislature, but not only in the legislature, with our colleagues in Washington, need to work to fix that. But it has to be a project where all of us are working together. Because the reality is that Vermont can move and we can move forward, and we have done great things in the past. I mean, as difficult as it is in Vermont, we are at the top of the ladder. Keep that in mind. But we need to go another rung up the ladder to get to the top. Senator Shumlin said the chairs of our healthcare committee, Senator Racine and Representative Meyer, will be taking up the various bills that are there that seek to get us to the place where we need to go. But we also need to be working closely with our federal delegation and with the President, because without their help, we cannot remove the barriers to the goal of having coverage for all Vermonters and all Americans. So thank you very much.